Welcome to episode 36 of 100 Days of Data. I'm Jonas, an AI professor, here to explore the foundations of data and AI with you.
And I, Amy, an AI consultant, excited to bring these concepts to life with stories and practical insights. Glad you're joining us.
Imagine machines helping doctors save lives by spotting diseases earlier and suggesting treatments faster than ever before.
That's the incredible promise of AI in healthcare. It's reshaping how care is delivered and how medical breakthroughs happen.
So let's start by defining what AI in healthcare actually means. At its core, it's about using data-driven algorithms and machine learning models to assist or automate tasks doctors and researchers have traditionally done.
Right. And those tasks range widely, from diagnostics like reading medical images to predicting patient outcomes to speeding up drug discovery. It's a huge field, touching almost every part of healthcare.
One foundational area is diagnostics. AI uses vast data sets of medical images, patient records, and lab results to learn patterns that might be subtle or invisible to humans. For example, deep learning models can analyze X-rays or MRIs to detect early signs of diseases.
I worked with a hospital system that implemented AI for lung cancer screening. Traditionally, radiologists manually examine CT scans, which can be tedious and prone to human error. The AI helped flag suspicious nodules, increasing early detection rates and reducing missed cases. It didn't replace doctors. It empowered them to be more accurate and efficient.
That highlights an important point. AI is rarely about replacing clinicians, but augmenting their capabilities. The underlying data, images, records, genetic profiles, is massive and complex. AI helps process it at scale.
And that scale matters in real-world settings. In drug discovery, for instance, pharmaceutical companies sift through enormous chemical databases to find promising compounds. AI models can predict how molecules will interact with targets in the body, speeding up trials.
Indeed, the traditional drug development pipeline can take over a decade and millions of dollars. By using AI to simulate molecular interactions and analyze clinical data early, researchers narrow down candidates quicker, focusing human expertise on the most promising leads.
I remember a case where an AI platform identified a potential drug target for an orphan disease. This catapulted the research timeline forward, offering hope to patients who previously had no viable treatments.
Another critical area is patient care and personalized medicine. AI systems analyze individual patient data, from genetics to lifestyle, to recommend personalized treatment plans. The idea is to move away from a one-size-fits-all model to truly tailored medicine.
Plus, AI-powered remote monitoring tools are transforming chronic disease management. Wearables and sensors feed data in real time to AI platforms that detect early signs of worsening conditions. This allows healthcare providers to intervene sooner, preventing hospitalizations.
Let's touch briefly on the data challenges here. Healthcare data is often siloed, sensitive, and noisy. Patient privacy is paramount, and regulations like HIPAA in the U.S. restrict data use, which complicates AI training.
Absolutely. In practice, consultants in healthcare institutions have to balance innovation with compliance. We often use techniques like federated learning, where AI models learn from data without the data ever leaving its source to keep information private while still benefiting from large datasets.
That's a brilliant example of adapting AI frameworks to healthcare's unique demands. Also, explainability is a big deal. Doctors need to trust AI recommendations, which means models should be interpretable, not just black boxes.
That's a challenge I see all the time. If an AI tool suggests a diagnosis or treatment, clinicians want to understand the why behind it before acting, especially when lives are on the line.
Historically, AI in healthcare started with simpler rule-based systems. Today, advanced deep learning and natural language processing handle unstructured data, like clinical notes. This deeper understanding is unlocking new value.
One exciting example is how AI helps analyze medical literature. With thousands of studies published weekly, clinicians struggle to stay current. AI tools can summarize findings and reveal insights tailored to specific patient cases.
As a result, AI is accelerating evidence-based medicine, bridging the gap between research and practice.
And it's not just hospitals. Insurers use AI to assess risks more accurately, and healthcare providers employ predictive analytics to manage resources, improving service quality while cutting costs.
Of course, ethical considerations and bias mitigation remain critical. AI models trained on biased data can perpetuate health disparities.
I've seen projects where AI tools underperformed with minority populations because the training data wasn't diverse enough. Addressing this requires deliberate dataset curation and ongoing monitoring.
Summing up, AI in healthcare is a dynamic intersection of cutting-edge technology and human expertise, powered by data, but guided by compassion and ethical responsibility.
And practically speaking, it means better diagnostics, faster drug discovery, personalized patient care, and ultimately lives saved.
Speaking of takeaways, my key one is this. AI in healthcare hinges on rich, high-quality data and thoughtful models that support, not replace, medical professionals.
And I'd add, successful AI adoption in healthcare demands collaboration between technologists, clinicians, and regulators, along with a relentless focus on patient outcomes.
Next episode, we'll shift gears and look at AI in automotive, from self-driving cars to predictive maintenance.
And if you're enjoying this, please like or rate us 5 stars in your podcast app. We'd love to hear your questions or comments about AI in healthcare, which we may feature in future episodes.
Until tomorrow, stay curious, stay data-driven.